Mr. Davis, you're recognized.
Thank you, Mr. Chairman, and let me thank all of you for your testimony and the insightful information that you have provided. As I listened, I was thinking about the district that I represent, which is a very diverse district. In our city, we name areas based on where people live and how they got there. So I represent Greektown, I represent Chinatown, I represent Little Italy, I represent Bronzeville, I represent city and suburbs, I represent upscale and low income. And it seemed to me that there are huge gaps in health status in my district, as much as 25, 30 points in some lineups. And it seemed to me that the health status that stand out the most in terms of differentials is between districts or areas that are low income and areas that are not as low income. And of course, many of the groups have a tendency to have diets based upon hereditary factors and of course also based on income. Dr. Gearhardt, could you share some thoughts relative to how do we, I've been around health conversations now for about 40 years, and we have essentially the same ones that we had when I started. Could you share some thoughts of how do we really deal effectively with this?
My pleasure. And I think your instincts are accurate. What we see in the data, that health and how it shows up, it really has a lot to do with your zip code and how much money you have and how much time you have to spend on food. And I think, I've been really struck by our panel and how much we're kind of agreeing a lot about there's real nourishing food, and then there's hyper-engineered, ultra-processed foods that are making us ill. And I think that hasn't been reflected in our policies and our communication to the American public and FDA labeling and USDA guidelines. And kind of a little bit of an elephant in the room is that there is a multi-billion-dollar processed food and beverage industry that is really who is benefiting and profiting off of the current status quo. We know very little about how these ultra-processed foods and beverages are being designed in a way that make it hard for us to eat for our health. The industry will say we're trying to maximize craveability, induce a sense of moorishness so people want to eat more and more and more. But all of that information is kind of locked behind closed doors. And so I think if there was an agreement in government policy with places like the FDA and the USDA, taxation, that really focused on, we know what real nourishing foods are, fruits and vegetables, beans, legumes, and we know the sorts of foods that are making us ill, and we made that clear, and in a system that promoted access and affordability for all people, it would really make a difference. There's a lot of targeted racial and ethnic marketing. We know that children who are Black and Hispanic and who are economically disadvantaged are exposed to more ultra-processed food and beverage ads than their more well-resourced non-Hispanic white counterparts. We're not all living in the same food environment. And so we have to do things to kind of even the playing field so everybody has the same access to nourishing food and aren't being targeted in ways that make it very challenging to resist these products that have been designed to tempt you.
Well, let me just end by, I guess, health education, health awareness, health promotion probably is as much help to these individuals understanding that ultimately it's them, to a degree, that's going to have to take much of the responsibility for their being and their health. So I thank you, Mr. Chairman,
Thank you.
and yield back.